Chapter 11. Exercise 1. Maths. These activities at the stage of medical education in the UK, given an A opposite. 1. Dissecting cadavers is undergraduate. 2. Keeping a log of surgical procedures observed and performed is postgraduate. 3. Working for 4 months in accident and emergency to experience this specialty is foundation program. 4. Taking a four-way attachment in obstetrics and gynecology is undergraduate. 5. Taking an online course of recent developments in cardiovascular diseases is continuing professional development. Exercise 2. Complete the sentence. Look at B and see opposite to help you. 1. Just before their final years, students have the choice to take an overseas elective in a hospital of their choice anywhere in the world. 2. Problem-based learning contrasts with an approach where each subject is taught separately. 3. These days, seminars are often interactive, with regular opportunities for the students to ask questions. 4. In clinical attachment, students learn how to treat and manage patients. 5. Students' selected modules can be a topic from outside medicine, such as a foreign language. 6. Dissections of cadavers is an important part of the anatomy component. 7. The medical school and the University of Edinburgh is one of the oldest in the UK. 8. She is consulting on the Royal of the leading pediatrics health specialists in the country. 9. The Royal College of Surgeons in Edinburgh dates from 1505. 10. We have a seminars each week where they discuss topic in a small group with our lecture. Exercise 3. Match is of these activities to one of the components of the undergraduate course described in B and C opposite. 1. Julia spent 6 weeks working in a small hospital in the Himalayas. Is overseas elective. 2. A group of students discussed together the possible reason for abdominal pain after meals in an obese 44-year-old male. Is problem-based learning. 3. A small group of students traced the pulmonary artery in cadaver. Is dissections. 3. 4. Otto spends months working in the pediatrics ward of the local hospital. Is clinical attachment. 5. Anne learns how to take blood from an elderly patient. Is clinical skills. 6. Juma chooses to study tribal medicine in his 4th year. Is students selected models. Chapter 12. Complete the phrases with verbs from the box. 2 phrases can be completed in 2 different ways. Look at A and B opposite to help you. Assess, deliver, demonstrate, provide, supervise, take. 1. Assess a competence or due to some time. 2. Deliver a training by ensuring the successfully completes her training. 3. Provide a course or a training program has teacher. 4. Take a course or a training program has student. 5. Demonstrate progress or competence. Exercise 2. Match the 2 parts of the sentence. Look at A, B, and C opposite to help you. 1. An FY1 is a doctor with the letter D in the first years of the foundation program. 2. A demonstrator is an anatomy teacher with the letter H. Who teaches dissections. 3. A clinical trainer is a consultant with the letter F. who provides training during periods of direct clinical care. 4. A supervisor is a consultant with the letter B, responsible for the training program of a trainee. Of a trainee. Trainee. 5. A medical school is with the letter G, part of a university responsible for medical education. 6. A placement is with the letter C, a period spent as trainee in a hospital or in general practice. 7. A college is with the letter A, various specialists responsible for delivering and assessing training in their specialty. A with the letter A, a fellow is a specialist with the letter A, who has reached the JS level in their specialty. Exercise 3. Write in full the qualification of the doctors and surgeons. Look and see opposite to help you. 1. Mr. Jung's husband is Bachelor of Medicine Fellow of the Royal College of England and Fellow of the Royal College in Ireland. 2. Dr. Doll is Bachelor of Medical Sciences, Doctor of Medicine, with member of the Royal College of Physicians. 3. Miss English is Bachelor of Surgery and Fellow of the Royal College of Surgeons of England. 4. Dr. Meriwether is Bachelor of Medical, Doctor of Medicine, with the Fellow of the Royal College of Surgeons. Chapter 13. Exercise 1. What kind of registration might this doctor obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor is provisional registration. 2. A newly qualified Nigerian doctor is limited registration. 3. A doctor who has successfully completed the first foundation year is full registration. 4. An CHO who has successfully completed the foundation program and gained a certificate of completion or training after several specialist registered posts is a specialist registration. Exercise 2. Write the abbreviation in words. Look at A, B, and C opposite to help you. 1. Any doctors who wants to work in the UK must register with the GMC. GMC is General Medical Council. 2. Some overseas doctor must pass the PLAB test before they can register. PLAB is Professional Linguistic Assessment Board. 3. Part 2 of the test consists of an OSCI. OSCI is Objective Structured Clinical Examination. 4. In any emergency, remember the ABC protocol. ABC protocol is iris, breathing, circulation. 5. Before you can obtain a specialist registration, you must have a CCT. CCT is Certificate of Completion of Training. Exercise 3. Complete the test. Look at A, B, and C opposite to help you. My name, Musan, came from Yemen. I came to the UK about 2 years ago, after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB to test sure that I could work safely in the UK. If I had to give some advice to other candidates, It will be taught at counseling station. You shouldn't simply memorize a set or phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year clinical training, I was able to obtain full registration, but I found it difficult to get an CHO post in my chosen specialty, pediatrics, as hospital now have to demonstrate their isn't suitable candidate from the EEA. Once I be complete my second foundation year, I should obtain a CCT, which will allow me to proceed to a specialties registration with the GMC. An important step of the road become a pediatrics consultant.